What causes UTIs in bladder health? Have you ever wondered what really causes urinary tract infections, or UTIs, in bladder health? Let's dive into the details. UTIs in the bladder are primarily caused by bacteria that enter the urinary tract through the urethra and multiply in the bladder. The most common culprit is a type of bacteria called Escherichia coli, or E. coli. This bacteria usually lives in our intestines but can contaminate the urethral opening and make its way into the bladder. The process starts when bacteria contaminate the area around the urethra, often from gut bacteria. These bacteria then colonize the urethra and migrate upward into the bladder. For bacteria to successfully colonize, they use structures like pili and flagella. These help them stick to and invade the bladder's inner lining. Once inside, they can multiply, produce toxins, and even evade the immune system, leading to an infection. Several factors can increase the risk of developing a UTI and contribute to bladder vulnerability. For instance, women are more prone to UTIs because their urethra is shorter and closer to the anus, making it easier for bacteria to enter. The use of urinary catheters can also introduce bacteria directly into the bladder, impairing its natural defenses. Additionally, any structural or functional abnormalities in the urinary tract that affect urine flow or bladder emptying can raise the risk of infection. Individuals with weakened immune systems, such as those undergoing cancer treatment, are at a higher risk for complicated UTIs. Sexual activity can also play a role, as it may introduce bacteria into the urethra. Hormonal changes during menopause can alter the urinary tract environment, increasing susceptibility to infections. In the context of bladder health, chronic or recurrent UTIs can lead to persistent inflammation of the bladder lining. This inflammation can affect the integrity of the bladder tissue. While UTIs are caused by bacterial infections, chronic inflammation or damage to the bladder epithelium requires careful medical evaluation, especially for those with bladder cancer or at risk for it. In summary, UTIs in the bladder are caused by bacterial invasion, primarily E. coli, facilitated by various anatomical, functional, and immune factors that compromise bladder defenses. To maintain bladder health, it is essential to prevent bacterial entry and address any underlying conditions that may predispose someone to infection. Always consult a healthcare professional for diagnosis and treatment to prevent complications.